Perfect. Welcome. I'm so excited to introduce our next two guests. I am, as everybody know, my name is Lisseth, and I am a connoisseur of trauma services and information, and just wanting to understand the best approach to addressing trauma in a holistic way. And so I'm excited to introduce my next two speakers and guests. I'm sorry, my guests, to talk about what they have been doing, what they're going to be doing, and what they just launched. And let's just jump right into it. So um, we have Eric Gentry and Jenny Brackman, and they are from the Forward Facing Institute. And I'm just going to let you know a little bit more about Dr. Gentry. So he went to become a faculty member and curriculum designer for the Traumatology Institute of Florida State University, and later served as a co-director of the International Traumatology Institute at the University of South Florida. Dr. Gentry is the co-author and co-owner of the Traumatology Institute training curriculum, which encompasses 17 courses in field and clinical traumatology, leading to 7 separate certifications. I mean, that's just, first of all, let's stop there and say, wow. And he is also the co-author of the critically acclaimed Trauma Practice Tools for Stabilization and Recovery, and published by Hoggart and Hubbard in 2014. He recognizes the risk of burnout in counseling professionals who work with trauma survivors. Dr. Gentry co-developed the Accelerated Recovery Program, the world's only evidence-based treatment protocol for compassion fatigue. I mean, that's great. And I've heard so many people use this, by the way. I just want to let you know. He is currently founding board member and vice president of the International Association of Trauma Professionals, counseling director of the Traumatology Institute in Canada, and owner of Compassion Unlimited, a private psychotherapy training and consulting practice based in Sarasota, Florida. And you'll hear my Spanglish. Everybody knows that my Spanglish comes out. So I wanted to say Sarasota, but Sarasota, Florida. And then Dr. Gentry is also the author of Forward Facing Trauma Therapy. Here's the book, if everybody can see it. This is a must read. I don't care what field you're in, you need to get this book. It's amazing. It is an evolutionary leap into the treatment of traumatic stress, as it addresses trauma and destructive symptomology as its source. The step-by-step guide is a great tool for anyone experiencing stress and can achieve immediate change by implementing this tool. I mean, I know that was a lot, but this man is amazing. And if you follow his career and his passion, you know that he's all about trauma and talking about an approach to healing trauma and for individuals, and not having it be complicated for anyone to use this tool. So I'm so excited and honored to have you here, Dr. Gentry. Um, and then I'm going to go ahead and introduce Ms. Jenny Brackman. She's the vice president of Forward Facing Institute, and she brings over 25 years of experience as a helping professional advocate for the marginalized. That is amazing. She graduated from Arizona State University with a Bachelor's of Science in Family and Human Development, and is a certified professional life coach and ACEs trainer. She believes her deepest education stems from facing her own trauma and walking the path of a fostered adopted parent. As a self-proclaimed trauma nerd, I love that, by the way, and passionate lifelong student, Jenny understands the science behind post-traumatic growth and healing adverse childhood experiences at a deep level. To those who may be off-put by the world of academia and fancy degrees, Jenny brings the confident compassion and charisma and candor of a survivor who has been in the trenches. So before partnering with Dr. Gentry, Jenny founded Resila, right? Resilia? Right. An organization designed to bring forward-facing tools to underserved population, nonprofits, and young leaders. Since joining the Forward-Facing Institute as the vice president in June 2020, Jenny's companies have paved the way for significant growth and expansion of the company. I'm so excited to have you both here. Thank you so much for allowing me to interview you and to have this conversation with you. Um, so I'm just gonna go jump right in and just start asking you guys a question about, your why the book, right? So, and then why the Institute, right? So the first question I want to ask to Dr. Gentry, why is understanding and treating trauma so important to you?
It's privileged to be here, and I hope my face is not too red after having read all that about me. That it's uncomfortable to hear all of that. But thank God I know how to self-regulate so that I don't
That's
have
right.
to jump out of my skin with it. Thank you. It was a beautiful introduction. I guess that the most salient aspect of the why is an ACE score of 9 out of 10. More than anything else, it was that. And my developmental trauma really set me on a course of being helpful to other people. But as people that have ACE scores that high are want to do, as I started into school, I developed a pesky little substance problem that worsened and worsened and worsened until I created a good deal of wreckage in my life and cleaned up in 1988 when I was 27. I had failed out of college twice, and once I cleaned up, then I was, I found out I was a pretty good student. I actually went to class and did the homework, and I graduated. I got my bachelor's. I got my master's, and went on and did my doctoral work kind of straight through that. But in that process of early recovery, what happened for me was the first year of recovery was wonderful. The pink cloud stuff they talk about, but by 14, 16 months into recovery, I had flawed PTSD that the drug use and alcohol use had just completely masked. Like, I didn't have post-traumatic stress when I was using. But as soon as I cleaned up, it all came forward, and I became debilitated. I couldn't even leave my house. That's how scared I was. And so I sought therapy. And spent 3 years in therapy, and it was brutal. It was old school, going back into the memories and walking through those, and it just blew me out of the water. And I ended up having a pretty nasty relapse for a short period of time, and got back into the rooms, back in a program in 1995. I've been clean since then. And, as I worked through that trauma, it became increasingly clear to me that was kind of, the same thing that was in Jenny's. I think not anybody, but most people that work through trauma have a passion to give back in the same way that people who are in recovery have a passion to give back to people who are still using. And I'll talk about that in a second. But to race on through, I spent a lot of years in private practice, and I was an anxious therapist. I learned all of the alphabet soup therapies, EMDR, DBT, NLP, all of those different types of therapy. But as I progressed in my maturation as a clinician, what I started seeing was that there were a set of principles that worked, a set of practices and principles that worked in all of those treatments. And I started at, as your interview said, I started my doctoral program at Florida State with Charles Figley, who was kind of the developer of the field of trauma. And he and I built the Traumatology Institute, and he was working on that same thing, active ingredients. And since then, that was in 1995 and 96. And we've just published a book, Bob Roten and I, on the active ingredients approach to the treatment of trauma using a salutogenic paradigm. It's just out. And so really have driven that all the way forward to central in the field of, instead of doing a model based, using a particular treatment, what we do is that we teach clinicians to learn the 4 things that heal trauma and be able to deliver those 4 things to trauma survivors in ways that fit to them, instead of making them step to us and doing a treatment manual. And those 4 things, they're really simple. It's a therapeutic relationship. It is the ability to calm your body and interrupt the threat response without using an external agent. We call that self-regulation, some type of exposure, and cognitive restructuring and psychoeducation. Those 4 things heal trauma. And so the more that I've worked on that, the more that I've seen that as trauma survivors, what we've done for 100 years with trauma is that if you come to a therapist in the West and you have a history of childhood sexual abuse and you're coming to see a therapist, there's an immediate focus of taking that person back to slogging through their memories. And that's been the dominant model in the field of Western psychotherapy for over 100 years, almost 150 years. And what we've rediscovered here over the past 10 years, especially with the advent of complex PTSD, is that a much more efficient way of doing that is something we call in vivo exposure, which is the ability to teach people to confront the things in their present day life that scare them. And doing that in a downregulated, relaxed body. And when they do that, what they do is they desensitize all these environmental things that scare them. The reason why they scare them is because the memories of the trauma, that these things they encounter are similar to their painful past learning. And when they confront the triggers here in the present in a relaxed body, they desensitize and heal the trauma of the past without ever having to address the memories of the past. So it becomes a really accelerated, catalytic, fun way for people to work with trauma that doesn't require them slogging through the memories. And it produces an immediate better quality of life here in the present as their symptoms are rapidly resolving and they're moving immediately towards a better quality of life instead of waiting until we get all the trauma memory processed before that things can be better. So it's a pretty exciting stuff, and you've read some of it, and the people that engage it, they just light up with excitement about getting to the other side of it. Something that they thought was going to be years of work, that they find in weeks that their lives are turning around.
I absolutely love it. Like, everybody knows that my background is in social work and psychology, and understanding that the process of healing trauma was you have to open old wounds, right? And have them go through that process. And then, and I was like, I don't think this is right. Like, as I'm sitting in the classroom learning the EMDR, and they're like, no, this is the way you heal trauma or treat trauma, because you can't heal trauma. And I'm like, I mean, there has to be a better way, right? And as a student, I'm just like, this is not good. We are re-traumatizing our clients just to help them heal from one thing. We're reopening other wounds. And when I read and I went through the online course and then read the book, I was just like, oh, finally, like, yes, someone is saying, no, you don't have to go through this process. It doesn't take years to address the healing. It doesn't take years to understand the triggers, right? That comes with that. And I use the word triggers and self-regulation often because of you. And I use it all the time with clients and people that I consult with. And I tell them, listen, and you need to know your triggers. In order to heal from trauma, you need to know your triggers, because if you don't know your triggers, right, how are we gonna address this and and heal from this, because then you get triggered again and then you don't know how to do this. So you need to know what triggers you, right? But then I also bring the concept of landmines. I don't know if you heard that before, but the landmines, right? And one, as a foreigner, I will always tell myself and tell everybody I'm a foreigner, is that the assimilation process, it's very traumatic. My background, I worked with a lot of individuals who were either refugees, displaced individuals, or children who've been trafficked and brought into the country. And my background was working with them for a lot of years, helping them reintegrate into society. How do you reintegrate to a society and be healthy when your home environment has also experienced the same trauma and they don't know how to deal with that? So what does that look like? And so talking about this in a cultural way, while using the alphabet, right, of theories and all these, it didn't make sense. It just didn't make sense. People were like, "Oh, Miss London, I don't get it. I don't understand." And they, like you said, they relapse. And then when relapse, they're like, "I'd rather be in this situation than to deal with this and years, and then like digging in on the scars that they had, right?" And so talking about this, right? I'm telling you, I don't know how many people I have recommended this book to. Like, I'm like, no, you need to purchase this. You need to purchase this. Like, no, this is something that you need to have with you at all times, because even the stories that you use in the book, it's so understandable. When it comes to theories of talking about trauma, it's people get too complicated with it, right? It just gets to the point where you're just like, yeah, this happened, you can do this. Okay, we need to use CBT, you need to talk about reality therapy, you have to do this, you have to address the approaches and steps of EMDR and be an expert in it. You have to make sure you train, like, all this complicated thing. And so when you're talking to individuals who are overseas, or just anyone who just wants that release of, I feel like I need more, that they can use this on themselves, right? They don't need to be like educated for 10, 20 years. They just need to understand what you're telling us here and the approach and the concept of this. So understanding that, right? I want to ask you, what was the reason you wrote this book, the Forward Facing Trauma Therapy book? Like, with the whole history that you have in trauma, why did you feel that you needed to write this book?
I'll do that in a kind of grandiose vision, because it really is, it's the first step of a vision of evolution of mental health in our country and hopefully the world. Because right now, the only way that somebody in the United States can get treated for their traumatic stress is through a licensed mental health professional. And with the paradigm the way it is, that somebody needs to have all that training to take somebody through their memory processing. So it's a really highly skilled thing, and that there's not very many clinicians out there to work with all the trauma that there is. So there's a lot of people that are only able to get one 30-minute appointment a month from the community mental health. So, having spent over 30 years of my life in a regular attendance of a 12-step fellowship, I've been the recipient of the best that the 12-step fellowships have to offer. I believe that my engagement in a supportive environment of men and women who love me, and that building that relationship has been as important, if not more important, than my psychotherapy, especially in helping me to live with the distress that I had on a daily basis. That working with Charlie in therapy helped me clear out the big trauma, but the impact of that on a day-to-day basis has been my engagement in 12-step fellowship. And what we know about 12-step fellowships is they've done a head and shoulders better job with addiction than has the institution of mental health. Well, color me an optimist, but I believe that same thing can be done with trauma. A community-based, peer-to-peer delivery of supportive. It does not take an advanced degree to coach somebody to confront the things that they're afraid of in a body that's relaxed. And somebody that is progressively confronting the things that they are afraid of in an intentionally relaxed body is healing their traumatic stress symptoms. So being able to create groups and communities where individuals are getting together and supporting each other in that process of resolving the trauma in their lives and going on to live with intention, which if we get time to talk about during this podcast, I'll talk about that a little bit, but to be able to live increasingly more intentional lives, less and less reactive lives. And in order to do that, they have to confront all of those situations where their physiological threat response in their body has jacked up because of their trauma history. As they lower that intentionally by releasing the tension in the muscles of their body and move on through the things that they're afraid of, but there's no danger, then they resolve all of that past. They resolve the present, which is really nice. They return to optimal functioning in there in the moment without distress. That's nice. But what's also happening is little by slowly, they are gradually shrinking the trauma ball of the past, so it has less and less and less effect on the person here in the present, which the more they do that. So building groups where peers are supporting peers and doing that works now as a triage process to divert a whole lot of people who are going to get their healing just in that group and never even need to step foot in a mental health professional's office. There will be people that we're going to need some more intensive services, but that group will show them as they become, that their symptoms are not abating. Then those will be the ones that get referral to the treatment and then come back. And for the rest of their lives, they have this network that they can come and share and be supported and loved in this group of people that are also about their own recovery. So that's the big vision. We're building the Institute to start that, and I'll let Jenny talk about that a little bit. But that's where this is all headed. It won't happen in my lifetime, but I'm excited about kind of getting the engine rolling towards a peer-to-peer recovery program from traumatic stress. That's my mission.
Listen, you don't understand that the awesomeness of what you are creating, the goals that you have is what's been needing for so long. I think that, as you know, America is considered to be a very individualistic country, but I think that they're wrong because we are very collective. And because we're so collective, we lean on people we love and are close to us for guidance. And so when you are experiencing something, the first person you go to is not a professional. And that's worldwide. You go to someone someone that can be there and understand and can help you de-stress, regulate, right? All of these things to be able to process what you're experiencing. And so the concept of a peer-to-peer approach to treating trauma, I mean, it's genius. It's genius, right? It's like, yeah, like why haven't we been doing this? But it's genius because I feel like now people can say, oh, okay, I can do this. No, I have been doing this. I have been doing this. This is great. And so listen, I tell you, I am a connoisseur of trauma and education and just the concept of just approaching trauma, and you do that beautifully. Okay. And I don't know if you are recognized on a daily basis, but I'm letting you know it's beautiful. Okay. So thank you for continuing the work on approaching trauma, especially for someone who's been in the field, who's been on the front line, where just trying to get the people from their homes to see someone, and the gap that there is, that no, I don't want to go there because I know what will happen. And so how do I treat the person where they're at? And this is how I treat the person where they're at, empowering them to know that, hey, you can do this for yourself. You can actually approach this. Let's try to regulate ourselves. Let's try to figure out our triggers, understand our landmines, and so that you are able to figure this out for yourself. And then when you're ready, we're able to walk together to a therapist if you need to for more, support. But you can also do this for your children and your family who are experiencing the same thing. So then you're creating this. And so being able to use this has been amazing. So, Jenny, I want to ask you this because you've been sitting there so quietly and so patiently. Thank you. Tell me a little bit about the reason why Forward Facing Trauma Institute has been created, and what is the importance of it, and if you can just share that with us, as Dr. Gentry has shared the purpose of the therapy and the concept as itself, the why is that of the institute so important?
Yes, thank you, and thanks for your enthusiasm. As I was sitting here, I thinking if Lisseth made an invitation, it would be the invitation to be the president of the fan club, Forward Facing Fan Club.
Yeah.
So yeah, appreciate all your enthusiasm. And when I think of the purpose of why we created the institute, I want to go back for a minute to my desperate search for something that was different than what I had found so far. And that would take me to 2015-ish. And I had done a lot of my own trauma work. I come to this with my own ACE score of 7 and 0 to 22 years of developmental trauma, and I was doing pretty well. I had done my trauma, I had done an EMDR, and had found that I was able to experience a pretty good quality of life. And then I had what I call a trifecta of trauma, in that within about 1 year, we lost a son who, one of our adopted sons, was no longer safe. Was not safe to live in our home, and that massive loss was catastrophic. And at the same time, we just about lost a daughter due to that, because of her trauma from that child. And then my husband developed necrotizing fasciitis, a life-threatening infection, spent 52 days in the hospital, over a month on a ventilator. And the combination of those 3 events in such a short period of time, those 3 happened within 3 months, although the leading up to it was about a year. Once my husband was home and he was recovering, it became very clear to me that I was not. And then I still was not. And that was really scary, because I felt like all the work that I had done for even 20 years before that was gone. And in that previous year of trying to solve this epic crisis as a parent of, my home is not safe anymore. And this is my whole childhood. All I wanted was a safe home for my children. And then we didn't have that anymore. And so that created this like frenetic drive to, okay, I'm going to learn everything about trauma there is to learn. And so I learned and I learned and I learned. And all I knew is that this daughter of ours was struggling more, and she was suicidal, and she was 8 years old. And I finally raised my white flag of surrender and realized, okay, learning about trauma is not getting me anywhere. And when I found, a Google search landed me on trying to figure out, is trauma contagious? Ran into Dr. Gentry's work, and through watching some of the first DVDs that I purchased, I realized, the reason that my daughter didn't feel safe, no matter what I learned about trauma, was that I was not in a relaxed body. Well, someone could have told me that a couple of years ago and saved our whole family a whole lot of pain. And I mean, seriously, it's so simple, but so life-changing. And to even in that time period to be still trying to heal and realizing I can still have my trauma and I can still need to work through it. But if I can interact with her in a relaxed body and she sees that I'm not scared anymore, then she's going to get better. And she did. And this was a child who had seen lots of psychiatrists and lots of therapists, and nobody could help her. And so that experience really led me to some pondering of why has this been kept to such an exclusive group of people for as long as it's been around. And not that the exclusivity was intentional, but it was for mental health professionals and medical professionals. And so I started doing a lot of research and just looking in, especially with our own state, just trying to figure out, was there anything that offered offered what I had just experienced, anything remotely close, especially to parents who are suffering, to faith leaders who were suffering, and found that there was nothing even close, and found that, in fact, according to my perspective, was the opposite, in that you hear just like trauma-informed care, trauma-informed care, trauma-informed care everywhere you go now in all these fields, but yet there's no foundation of, if you're going to offer trauma-informed care to another person, but you're not in a relaxed body, you're only going to generate symptoms for yourself. And to me, that's such a disservice. And it sets people up to fail and then wondering and then create shame. And so the purpose of the Institute, it's a long beginning, but the purpose of the Institute is to do what Dr. Gentry thinks will not happen in his lifetime, and I think it will, which is, let's do this. Let's certify people. Let's create a program that will equip. So for years, Dr. Gentry said that 80% of what he does can be done by anyone. And so the purpose of the Institute is to equip that anybody and everybody with that 80% of skills. And we've got people who are excited. We, are in the final stages. We've been saying that for a while, but it's true. Every time we finish something, it needs to be revised. And but purely, we're going to be certifying people, certified forward-facing coach. And there's a track for health and wellness, which is most people. And then there's a track for professional resilience, which is to help people in the workplace. And right now, this impending crisis, as soon as COVID kind of calms down and we're not in survival as a society anymore, now we have the crisis of all the medical responders and the teachers and the law enforcement officers that are going to have a pretty epic need for healing, because we can't afford to lose these people. So that's why there's probably more questions in there, but that's why we started it.
No, I'm glad that I have enrolled in this, because I have been waiting for something like this. So you'll see my name everywhere. Just know I'm not a stalker. I'm just excited.
No worries there.
But you're right. So and Jenny, thank you so much for sharing. And because this is what I want individuals to understand, that there's so many of us who have been exposed to trauma, and so many of us who are experiencing a lot of trauma right now, and we don't know what to do. So we're on Google, we're trying to find, we're on YouTube, we're trying to figure it out. And everything that they come up with is, you have to see a therapist, or you have to go through a massive education. And the discouragement that people feel because they don't know how to feel better, because there's no quick solution, right? And so for this approach to be available to everyone, it's so awesome. I don't usually share my story, but in 2018, my sister was on March 8th, my sister gave birth to my nephew, and he was 21 weeks in gestation. And I remember his due date was June, and he was born in March. And I remember being in the called and being rushed to the hospital, like, um, you need to choose, who do we keep, who do we save? And that was hard. Like, I'm looking at my sister, and then I'm looking at her about to be rolled out to get the child out, right? And then within like 10 minutes, they bring them both out. She's in the bed, and then he is in this incubator, and he's the size of my palm. And all these tubes and all these things. And I remember just mentally shutting down, right? Emotionally, I could not be emotional. I had to be the person that be a robot, that I could just make decisions in there. Because at that time, her husband was in Australia. My parents were in San Antonio, and his parents were in Dallas. So I was the only one there. And so from 2018, basically to 2019, just dealing with him being in hospital, like, oh, he's not going to make it this night, back and forth, and just the trauma of it all. Mind you, at this point, I'm traveling all over the US, trying to reintegrate traffic victims into their home, society, train professionals how to communicate with these individuals, and then dealing with this, and then figuring out that my workspace was not equipped to heal or to work with someone who's traumatized. And so then you have employees who are exposed to personal traumas, dealing with their work traumas, and then expect the individual to perform at 100. And I recognized that I was failing myself. I was still doing a great job, but I recognized that I personally was falling apart. Um, and I tell this to people, like, I literally will drive to the mental hospital and sit in the parking lot, like, is this the day that I check myself in? Because I was so tired, I was so traumatized, I was so burned out, I was experiencing so much, and I didn't know how to find a way to relieve. I'm like, I don't have time to sit down with a therapist to help me process through this. I don't have time, and I would literally drive myself, and I'm like, this is not the day because I don't have time. And then I will drive away. And this was for almost a year. And I was just like, there has to be something. So I found, again, like you, Google. I went on Google, and I was like, there has to be something that I can do as a social worker, as a mental health professional, that I can just learn quickly and use it on myself. And so when I found Dr. Gentry's information about self-regulation, I was like, oh, oh, I have been tense. I have been, like, oh, trying to make it, and just like, if you release your fist, everything will fall apart. I've been so tense. And then he's like, well, you need to relax. And I was like, no, 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 no. I can't relax, because if I relax, everything will fall apart. No, you need to be relaxed so that you can find healing. No. And so the concept of, like, what we are been trained to do, right? Hold on, don't let go, keep, move forward in all of this with what you can, try to figure out how to treat yourself, right? And then he's telling you, no, you need to relax, because healing happens when you're in a relaxed state, and when you're and so it goes against what we as professionals learn, right, in the field, but also what we are taught as children, you know just push through it, right? Go ahead.
Well, and I think in a way, it goes against our biology, because our biology tells us to survive. And it goes against our ingrained patterns of self-defense. And so whether we've been exposed to mental health training or to therapy, but you're right, we start learning it as unconsciously from the very beginning, that I when I need to survive, I need to be tense. And then very few of us learn or have any developmental experiences that tell us, oh yeah, just let go and then you'll be great. Development teaches us the opposite.
It does. It teaches us the opposite. And in what Dr. Gentry teaches us is like, no, no, no. I need you to. So I tell this in all my trainings and consulting with people. I say everything you know, put it in a box. Listen, what you know, you'll be like, oh, that goes against what you're teaching me. I need you to put everything in a box. Right now, you're not an expert. Put everything in a box. And that's basically what he was telling us. No, I need you to put everything in a box. Everything you know, put it in the box. It doesn't matter. I need you to understand that what you've been taught goes against the approach to healing. And so I wanted to read a little expert here, a part here from A Formula for Hope, because I found this piece. It was just like, listen, I have things highlighted in here, okay? To heal ourselves, we must make intentional use of the space Viktor Frankl described that lies between stimulus and response. In that space, with a relaxed body and clarity of mind, we can consult our moral compass and allow the best within us to guide our actions. Like self-regulation, the recipe for intentional living is simple, but not easy. Listen, that just like, well, that shuts everything down, guys. I'm ready. I'm good. Like just a little piece right there. The formula for hope. Like I that is exactly it. Like you cannot find healing. You cannot regulate yourself until you completely relax and regulate. Like you need to do that. And I have a few more questions. Please bear with me. I know I'm very excited about this conversation and interview with you guys. So right now, I'm actually working with a church that is part of they got a contract with a major university here to provide services to this particular zip code. And I said zip code, not in just a school, a zip code, because this zip code has been traumatized for like decades upon decades upon decades. And last year in March, we had a tornado, and then not a week and a half later is when COVID happened and shut everything down. So this community as itself, the zip code, has been impacted so bad that, I mean, if you drive through, you still see that houses don't have roofs, they have tarps, and people are living there. People are still trying to get light and energy into their homes. I mean, it's still happening. So I have been tasked, right? I was asked to run this program, a support group for this community to provide support for the adults ages 18 plus, and then for the young adults 13 to 18, and to provide them with how do you help them self-actualize like their behavioral needs. How do you address the traumas that you have experienced with not only the external, but your internal, but also dealing with the fact that your whole lineage right now has also experienced trauma. How do you find healing and support when the people that we usually go to for guidance can't give us guidance because they're dealing with their own traumas? So again, I'm using your approach to this because this community, I think that the first thing that they need to do is understand that they themselves are their own behavioral agents. They're their own advocates. They're their own healers in terms of dealing with this. This particular area is where the Fisk University is, which is one of the first African Americans university in Nashville, in Tennessee. And so this area, around the whole area, has a lot of historical areas and places there, because this is where the slaves used to live, and the community is very strong in that. but the whole process of providing support for this community is not, everybody wants to be like, no, let's just refer them to a therapist. I'm like, yeah, that's not going to work. This community needs more than just therapy. This community needs to understand that we need to unclench, that we need to relax, that we need to deal with the approach of healing by understanding the need for self-regulation. And so I want you to understand that your work is, it's, you say that you don't think that this can happen in your lifetime, but it's happening. It really is happening, because individuals like myself who understand the need of a community, it's seeing the need and using your tools as like, oh no, we can do this because he's seen it done. It's easy. No, you can do this for yourself. Let me give you some homework. And then when I give them the people the homework, they come back to me like, oh my God, Miss London, I felt so good. There was a moment where I was stressed, and I remember you told me to breathe and relax and then do the whole, self-regulation in the process of looking and understanding my triggers. And I was like, this is the first time I was able to not feel as if I was stuck. And so this is the work that is being done by utilizing your work. And so I'm excited because the Institute is going to be training individuals who are professionals, but also individuals who want to know more and want to be trauma specialists or trauma, advocates, to be able to say, no, I've gone through this. Is it 12 weeks, or how long is the program?
Well,
7 weeks?
The entire program.
Yes, because I know that you split it up. There's like different sections, but how long is it total?
We're guessing it'll take a minimum of 6 months to actually go all the way through. That's about the fastest. It might be quicker eventually, but that's about what it is right now. However, we also like to emphasize people, all it takes to be a peer leader is one step ahead and a little bit of hope. So the whole communities can begin to start supporting each other with forward-facing principles, whether they're fully certified or not. Because if you have that, that's the whole essence of the 12 steps, is that I'm just one step ahead of you, but I do have hope and I do have a tool. Can I jump into that, the whole community thing for a second? Because I've had a thought come up.
Please. Yes.
I think when you're dealing with a community like you described, before teaching self-regulation, I think the important thing for them to understand would be the difference between am safe and feel safe, because not a single one of those people who live there feel safe, but there's a pretty high chance in that moment that what you're talking to someone that they are safe. And no one's going to be willing to self-regulate if they don't think they're safe, because you got to hold on when you're in danger. That's at least what our brains tell us. And so that's in the psychoeducation part, when we go into the difference between being safe and feeling safe. And then we give permission for there to be fear. Like I can be safe and feel afraid. Now I'm willing to self-regulate, because I realize, okay, this did happen and this might happen, but maybe just for 30 seconds. I can acknowledge, okay, I'm safe. I'll let go for these 30 seconds and regulate. And it's okay to be scared. Well, lo and behold, now I regulate and wow, I'm not as scared.
No, and that's exactly it. I think that the process that it has been done is, especially for a community, and I'm excited to interview Mr. Xavier Justice next week and to talk about the community and how to implement your work, Dr. Gentry, in communities, minorities, and in communities who are building resiliency and who are being traumatized so much. And so I'm excited to interview him. And thank you for that recommendation. So when it comes to the whole safety and like the I'm safe versus do I feel safe, I think that is exactly it. And thank you, Jenny, for bringing that up. Is, when you allow someone and I don't want to use allow because we don't allow anyone. When we open up the doors for someone to
Invite. I like.
start to, yeah, right, to feel and to recognize their feelings and where they're at and all of those things, as a mental health professional and just a trauma advocate as a whole, I I find it that individuals, when you talk about safety, don't know what that is, you know, and it's heartbreaking, but again, it's not something that we're taught. It's not something that we talk about at all. And so when here we go and talk about like, well, what is the difference? Like, the I am safe versus feel safe, like what does that mean? And so when you go through that concept, and this is the reason why I'm bringing it up, because I want other professionals or just individuals who are wanting to use this work and do this work, is that you need to understand that sometimes people may not understand that, and you need to show them what that looks like, you know and it's not a modeling per se of what that is, but kind of describing and showing examples of what does a safe space looks like and what does feeling safe looks like, so that they can understand, because oftentimes they don't know. And so I'm excited for the institute, because I think that, um, listen, I'm out there always, I love training. And so I am my mother's child. My mother loves training. So she will sit through a bunch of trainings, and I am the same way. And I just get trauma trainings and and it's just like, oftentimes they say the same thing over and over and over again. And so I'm excited about this certification, because the book doesn't say what others people say, right? That's the first thing. It's not the same. You're not going to get the same information. You're going to get a different approach to dealing with trauma. That's the first benefit. The second benefit is the fact that you are literally taught how to work with the people as a collective, right? You're working to learn, to work as in a support group. You get the support from not only the professionals from your institute, but from your peers who are in the course with you, which I think that's great. And I think that you guys, I know you guys say that you guys are still refining and trying to get to the last. I think it's great that you guys are still intentional about making sure that this is a peer-to-peer certification and support through the certification. So thank you for that. So in understanding that, and kind of getting your feedback of us to the forward facing trauma therapy, what is your 5-year goal? Whoever wants to answer that, it will be fine.
Well, it will be that I want to preface that with a couple of different things. You've talked about that this simple. You read from the passage, simple, not easy. And when people listen to you saying that you relax and you don't have trauma anymore, that's true. But what people don't know, the way that trauma works is what the essence of trauma is the perception of threat here in the present, where there is little or no danger, because the past is intruding into the perceptual system here. And people that live in that state for years and years, what happens is they don't feel their bodies. So they don't know that they're not relaxed. They think that they're relaxed, but they're not. So while this stuff is really simple, it's nuanced and complex also. And the truth is, though, you cannot have any kind of stress, including traumatic stress, in a body who is relaxed. And so as we begin to promulgate that message forward, as we begin to teach that, and it begins to saturate consciousness across our country and around the world, that's what I'd like to see happen over the next 5 years, so that people who are reading our work and engaging in our work, what they're absolutely certain of is not only is there this bona fide individualized practice that can help them to leave behind the effects of their trauma and transition into becoming the man, woman, child, partner, parent that they want to be, becoming ever more intentional in word and deed in real time. And that the two of those things are recursive, is that the more that they resolve their trauma, the more they're able to be intentional. So what my hope is that those people, children and grandchildren that you are working with, that as they move into adulthood and they're finding themselves replicating the patterns of their parents with their own children, that they realize that there's another way, that they can begin to pivot toward being who they want to be. And in the process of developing intentionality in everything, they have begun a process of resolving the trauma of the past. And that the two of those things can hook up in tandem with each other in the forward-facing process. So I get excited about people being able to envision and have surety that recovery is available for them without them ever having to step into a therapist's office. That would be my 5-year plan, is that there's enough people out there that are practicing the forward-facing protocols, that begins to saturate communities with that knowledge and that understanding. That's my hope.
Oh,
I
that's
would
great.
say, additionally, from something measurable, is to have these groups that are springing up, that are we're post COVID, and now we can, so far, everything that we've done except for a group I did a year and a half ago has been over Zoom, and that we're having community spaces where it doesn't have to be led formally. It's just, there's a protocol, that there's a method that's followed, and we've seen the power and the efficacy of that as an ongoing thing. And secondly, you keep talking forward-facing trauma therapy, and man, if you like that, so forward-facing freedom is coming out in a few months, which I think is 100 million times better as far as how it walks a lay person through all of the skills. And man, I just hope that gets everywhere, because it's a really inviting book, and just peppered with narratives of what it actually looks like when someone's in a dysregulated autonomic nervous system as they're going throughout their life, and then how that changes as they start applying the different principles, and that it's at a really digestible reading level. And I'm very excited for that, and I just hope it gets everywhere. That's would be my hope and vision.
Listen, I'm excited. I'm already going to order it. So the moment it comes out, I will be getting my copy, because I'm excited. For the past 2 years, I've created 2 different training programs for my company, and it was looking at the workplace trauma and then looking at an advocacy training, because that one of the things is, I worked so much with global organizations, especially in the West Africa area, and this is something that I constantly bring up, and they're like, no, we don't want any Western theories. And when I explain to them, they're like, oh, this is good. And I'm like, exactly, this is really good. And so I will be traveling to both Ghana and Nigeria this summer, God willing, with the whole COVID thing. And one of the things that I will be recommending, and I'm going to be trying to get a few more copies of this so I can provide to individuals in the northern regions where they're not close to a clinic or psychologist or anything like that, because my goal is to teach them how they can provide that type of healing to their township and to their tribe. And so I will be out there for like 3 weeks and traveling to different townships for that. And so that's my goal. And so that's why I'm excited to be a part of the certificate program, because utilizing what what my social work and psychology background, which is okay, but also, implementing the advocacy approach that I've been using for the last 2 years with Dr. Gentry's approach has been so great. So I'm so excited to provide this for individuals in Nigeria and Ghana, and hopefully by the end of the year, Zimbabwe, because I'm getting a lot of connections to be like, hey, can you come and help us train and things like that? And I'm like, this is great tool. I use this, sprinkle it throughout my trainings and conversation with people. So I'm excited for the Freedom, Forward-Facing Freedom book, Dr. Gentry. Again, you have great fans out there, and I'm definitely one of them. Like Jenny said, I may be the president. I don't know. Maybe. I don't know. I'm excited about this. And I'm just so grateful that you guys were able to take the time to talk to me about, forward-facing trauma therapy, but also your institute, the program itself. I just want to ask one more question before we wrap this up, is when can people sign up, or has it started, the program started, or where can they go? And I'll provide the links, but I just want to let people know, when does the program start, or has it started already?
Parts of the program have started. So the educational components, most of that people can do, and those are classes that they take on the various educational platforms. And the first group, the group that you're referring to, that's the small group process called Forward Facing Me. That is, we're going to be doing that ongoingly. So the group I'm starting next week that you're a part of, we still have 3 spots. So by the time you post this, it'll be started. But and then Dr. Gentry is going to be leading a group next that starts in February. So basically, people can contact our website, www.forward-facing.com. Find us on Facebook and LinkedIn, and yeah, we're pretty good about getting back to people. And yes, we just want to help people really get back to what their mission is. And for sometimes that mission is just feeling safe to feel alive. And sometimes that mission is being able to live in their profession the way they want to be.
No, and that's exactly what you guys are clearly showing with your work and with your institute, and you guys have a great, I would say, I don't know if I will call her recruiter or person. Listen, Molly, you guys have Molly, and she is amazing. And I send people to Molly all the time. I'm like, Molly, I'm sending you this person. They need to know more information. Do your work. And because she's a great asset, and I just want to let you guys know that she's a great asset to your institute, because I definitely utilize her a lot. So just a little bit before we head out. So tomorrow, next week, I will be interviewing Xavier Justice to talk about the resiliency, just the community, implementing this into a community. And so I'm excited about that. So again, thank you for that connection. And again, I just want to say thank you for allowing me, little me, to ask you, you guys, the expert and amazing author, on these questions to understand the purpose of this forward-facing trauma therapy, and how this is literally a game changer in the trauma field. So I'm excited. I'm excited for people to hear about this. I'm excited for people to reach out to you guys and enroll in your courses and in the institute and be a part of this certification process, but also to be an advocate for your institute as I travel, and continue to work globally. And so you have an advocate in me, and I'm grateful for that. So again, thank you for your time, and I'm excited to be a part of the Forward Facing Institute family. Even though you didn't say I'm a family member, I'm telling myself I'm a family member. So thank you, thank you. So any things you guys want to add? Any last things that you guys want to let us know about yourselves or the Institute?
Just that it's a privilege to get to do this, and thank you for being so accommodating. It was really nice to be here with you. Thank you very much. Yeah.
No, thank you. Perfect. So I'm going to go ahead and end it.